I'm a level 1 nursing student, and today I'm going to be validating on a sterile dressing change. So before we go into the patient's room, we're going to check in the doctor's order. Gathered all my equipment. As I come in the room, I will wash my hands. I will identify myself, identify the patient, provide for privacy. I will explain the procedure to my patient. I will be changing his dressing today and asking if he has any questions. I'm going to raise him up to a working level. This is the wound. I'm going to take off the tape. I'm going to open up my wound. I'm going to check on the dressing, if it's saturated, any drainage, blood. I'm also going to be assessing the skin around the wound, if it's red, swelling, if there's any necrosis. I am now going to take out the packing of the wound. I'm going to check the length of the wound, the size of the wound, what type of wound is it, the depth of the wound, how is it healing. I'm going to put this away. I'm now going to set up my sterile field, so I'm going to take my gloves off. And set up my field. Going to open our towel drape. Pick it up from the edge. Take the blue, find the edge. Let's see where it is. Going to placing our bowl on the sterile field. We need to open this up. Place it. Good. Next thing I'll do is putting sterile sealing. I'm going to lift the cap. And I'm going to be pouring it. Set that aside. I'm going to get my tape ready for my patient. I'm going to put it on their clean gown. I will be putting our gauze pads on. I'm going to open it up. Over, drop, away, throw out. Open. Drop, away. And one more. Last thing to go on our sterile field is our ABD pen. So I'm going to open that up. Open this up carefully. Pull away. Throw out. I'm going to push this away from me and open up my sterile gloves. Using my non-dominant hand first, I'm going to put this glove on. Take the cup in the middle, place it over there. I'm going to come back to my patient, clean his wound. Going to properly place my stuff. I'm going to determine my clean hand and my dirty hand. My right hand will be my clean hand, my left hand will be my dirty hand. I'm going to clean the wound inside, out, one motion. Throw it away. Clean hand. Same thing, in, out, one motion, throw it away. Going to clean around the wound. Once, throw it away. Other side. At this time, I would change my sterile gloves to pack our wound and put the ABD on, but since we are limited on supplies, I'm re-changing my gloves. After I re-change my gloves, I'm going to pack the wound. That's in there. Okay. I'm going to take my pad, open it up, place it over our wound, and take the tape that I took before and tape it. After I put it in place, I can tape around it. I just did two, just to secure it. I would then take my extra tape I have here. I would initially date it, time it, and put it on the patient's ABD to show that I had changed their dressing. I'm going to put the patient back in a comfortable position, ask him if he needs anything else, place the call bell, take my gloves off, wash my hands, clean up my field, side rail up, bed down, I'm going to document accordingly. I'm going to document what I saw. I changed the dressing in a sterile field. If I saw any necrosis, infection, drainage, and how I changed it, and wash my hands before I walk out of the room. And that was my video.